It's time for an apple fritter. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day's The Fritter. I'm your host, Jimmy Apple. How you feeling today, my friends? You feeling good? You feeling strong? You feeling better than you did yesterday? Excellent. You can't ask for better than that. I want to remind you, we have a new chat room. It's called An Apple a Day Chat. It's on Facebook, and it's all about this podcast. You can get there by going to www.famousapple.com/Apple Chat. That address will be in the show notes for this podcast. We have got a good one for you today. Today we're talking about rheumatoid arthritis, or RA as it's better known. So sit back, relax, and listen to what Dave has to tell us about rheumatoid arthritis.
What is rheumatoid arthritis? Rheumatoid arthritis, RA, is an autoimmune disease that is chronic. It occurs in the joints on both sides of your body, which makes it different from other types of arthritis. You may have symptoms of pain and inflammation in your fingers, hands, wrists, knees, ankles, feet, toes. Uncontrolled inflammation damages cartilage, which normally acts as a shock absorber in your joints. In time, this can deform your joints. Eventually, your bone itself erodes. This can lead to the fusion of your joint, an effort of your body to protect itself from constant irritation. Specific cells in your immune system, your body's infection-fighting system, aid this process. These substances are produced in your joints but also circulate and cause symptoms throughout your body. In addition to affecting your joints, rheumatoid arthritis sometimes affects other parts of your body, including your skin, eyes, mouth, lungs, and/or heart. Rheumatoid arthritis affects more than 1.3 million people in the United States. It's 2.5 times more common in people designated female at birth than in people designated male at birth. RA usually starts to develop between the ages of 30 and 60. But anyone can develop rheumatoid arthritis. In children and young adults, usually between the ages of 16 and 40, it's called young-onset rheumatoid arthritis, YORA. In people who develop symptoms after they turn 60, it's called later-onset rheumatoid arthritis, LORA. Rheumatoid arthritis affects everyone differently. In some people, joint symptoms develop over several years. In other people, its symptoms progress rapidly. Many people have time with symptoms, flares, and then time with no symptoms, remission. Symptoms of rheumatoid arthritis include pain, swelling, stiffness, and tenderness in more than one joint. Stiffness, especially in the morning or after sitting for long periods. Pain and stiffness in the same joints on both sides of your body. Fatigue, weakness, and fever. The symptoms of a rheumatoid arthritis flare aren't much different from the symptoms of rheumatoid arthritis. But people with RA have ups and downs. A flare is a time when you have significant symptoms after feeling better for a while. With treatment, you'll likely have periods of time when you feel better. Then, stress, changes in weather, certain foods, or infections trigger a period of increased disease activity. Although you can't prevent flares altogether, there are steps you can take to help you manage them. It might help to write your symptoms down every day in a journal, along with what's going on in your life. Share this journal with your rheumatologist, who may help you identify triggers. Then you can work to manage those triggers. The exact cause of rheumatoid arthritis is unknown. Researchers think it's caused by a combination of genetics, hormones, and environmental factors. Normally, your immune system protects your body from disease. With RA, something triggers your immune system to attack your joints. An infection, smoking, or physical or emotional stress may be triggering. Scientists have studied many genes as potential risk factors for RA. Certain genetic variations and non-genetic factors contribute to your risk of developing rheumatoid arthritis. Non-genetic factors include sex and exposure to irritants and pollutants. People born with variations in the human leukocyte antigen, HLA, genes are more likely to develop rheumatoid arthritis. HLA genes help your immune system tell the difference between proteins your body makes and proteins from invaders like viruses and bacteria. There are several risk factors for developing rheumatoid arthritis. These include family history. You're more likely to develop RA if you have a close relative who also has it. Sex. Women and people designated female at birth are 2 to 3 times more likely to develop rheumatoid arthritis. Smoking. Smoking increases a person's risk of rheumatoid arthritis and makes the disease worse. Obesity. Your chances of developing RA are higher if you have obesity. The most important goal of treating rheumatoid arthritis is to reduce joint pain and swelling. Doing so should help maintain or improve joint function. The long-term goal of treatment is to slow or stop joint damage. Controlling joint inflammation reduces your pain and improves your quality of life. Joint damage generally occurs within the first 2 years of diagnosis, so it's important to see your provider if you notice symptoms. Treating rheumatoid arthritis in this window of opportunity can help prevent long-term consequences. Treatments for rheumatoid arthritis include lifestyle changes, therapies, medicine, and surgery. Your provider considers your age, health, medical history, and how bad your symptoms are when deciding on a treatment. The safest drug for rheumatoid arthritis is one that gives you the most benefit with the least amount of negative side effects. This varies depending on your health history and the severity of your RA symptoms. Your healthcare provider will work with you to develop a treatment program. The drugs your healthcare provider prescribes will match the seriousness of your condition. It's important to meet with your healthcare provider regularly. They'll watch for any side effects and change your treatment, if necessary. Your healthcare provider may order tests to determine how effective your treatment is and if you have any side effects. When combined with the treatments and medications your provider recommends, changes in diet may help reduce inflammation and other symptoms of RA. But it won't cure you. You can talk with your doctor about adding good fats and minimizing bad fats, salt, and processed carbohydrates. No herbal or nutritional supplements, like collagen, can cure rheumatoid arthritis. These dietary changes are safer and most successful when monitored by your rheumatologist. But there are lifestyle changes you can make that may help relieve your symptoms. Your rheumatologist may recommend weight loss to reduce stress on inflamed joints. People with rheumatoid arthritis also have a higher risk of coronary artery disease. High blood cholesterol, a risk factor for coronary artery disease, can respond to changes in diet. A nutritionist can recommend specific foods to eat or avoid to reach a desirable cholesterol level. Surgery may be an option to restore function to severely damaged joints. Your provider may also recommend surgery if your pain isn't controlled with medication. Surgeries that treat RA include knee replacement, hip replacement, and/or other surgeries to correct a deformity. Although there's no cure for rheumatoid arthritis, there are many effective methods for decreasing your pain and inflammation and slowing down your disease process. Early diagnosis and effective treatment are very important. I hope you found this informative. I'm gonna pass this back over to Jimmy. Have a wonderful day.
Hey, thanks, Dave. Isn't he getting polite? Have a wonderful day. That is very nice. Thank you, David. That sounds painful. Just the name itself, rheumatoid arthritis, just sounds so painful. I want to thank you, the listener, for being here today. And I want to ask you a favor. Please, do me a favor. Be the reason somebody smiles today. Give them a wave, give them a hearty handshake, give them a pat on the back. Say something nice to somebody. Be the reason somebody smiles. You're going to enjoy what it feels like when you do that. It's going to become habit forming, that feeling. And that's a good habit to have. Make people smile. Here's another thing. Look at things from the bright side. No one ever went blind by looking at things from the bright side. Can't hurt. It can't hurt, my friends. Hey, you've been listening to an Apple Fritter. My name is Jimmy Apple, and I'm going to talk to you again tomorrow. Have a great one today, my friends.
Join Jimmy tomorrow for another Apple Fritter. In the meantime, stop over at our YouTube group page, Living with a Disability, join in the conversation and make some new friends. See you next time.